Um,
Hi, Dr. Gonzalez. Good afternoon. I'm Esha, a high school student who's interested in being a veterinarian. I'm excited to introduce our speaker today, Dr. Sara Gonzalez. She received her DVM from the University of Florida and became a diplomat of the American Board of Veterinary Practitioners in Canine and Feline Practice in 2021. Dr. Gonzalez spent several years in small animal private practice and on faculty at Kansas State before moving to Georgia in 2019, where she serves as Clinical Associate Professor of Community Practice and General and Behavioral Medicine Section Head. Dr. Gonzalez instructs veterinary students in dentistry, vaccinology, professional and clinical skills, and spectrum of care. As a small animal general practitioner, she primarily works with senior veterinary students on their clinical rotation at the UGA Pet Health Center. Her research interests include scholarship of teaching, vaccinology, and dentistry. When she's not working, she enjoys spending time with her family, traveling, and completing artistic endeavors. I'm thrilled to welcome Dr. Gonzalez to the interview series on the careers of veterinarians. Thank you so much for chatting with me today.
My pleasure. Thank you so much for having me.
So, first, I was wondering if you could tell us about your work and also share about your education, training, and career evolution.
Absolutely. So I have some slides for today, just to kind of make it more fun to listen to me talk. The first part will be covering your questions. So I'll just go ahead and get started. So right now I'm a small animal general practitioner, but I work in the vet school. So I get to train the next generation of students on how to be small animal general practitioners or primary care, as you may think of it if you're trying to equate it to human medicine. And so even though I live in Bulldog country now, I'm from Florida and I'm a proud Floridian. I went to vet school at University of Florida and I'm a Gator. So around this time of year, there's a lot of conflict with my colleagues because we have a big game coming up in a couple of weeks. Um, but I'm from South Florida. Never really thought that much about leaving Florida. I really loved being in Florida, and both my parents were Gators. And so it was a no-brainer for me to go to college at UF. I didn't really know 100% I wanted to be a veterinarian at that point. I thought that it seemed like an interesting career path, but basically, like anything in math and science, I was drawn to. So I still had some other things, but it was when I was like nurturing a sick pet that I had that I realized I did find a lot of passion in helping animals, and I decided to become a veterinarian. So I did my undergrad, my master's, and my vet school at University of Florida. Following that, my husband, who I met in grad school, got a job at Kansas State University. And so, as a Florida girl who never thought I would be so landlocked, I moved to Happiness, Kansas, or Manhattan, Kansas, the Little Apple, where I spent 8 years, the first 5 in general practice. And then after that, I also went on faculty at K-State, Kansas State University, as an emergency clinician. And mainly that was because I was trying to get my foot in the door with academia. I did enjoy emergency, but what I really wanted to do was small animal primary care at a university. And so I got the job at University of Georgia in 2019. In February, I started, and I've been there ever since. And since then, I've started from being the newest person to now the most senior person and in charge of a lot of things. And so it's been an interesting 6 years, and I love it. And I say go dogs every day, except for one day a year when I still say go Gators. Um, so a little bit back to my career evolution and my path to vet school. I Other things I was interested in besides math and science were art. So I actually entered as an art major when I started undergrad. And I just found that the division of my time between the science labs and the art labs, it really just was like consuming me. And I found it, I couldn't really be great at both, and I had to choose. And so and ultimately ended up choosing vet med. And so that was my undergrad, and I did great in undergrad, and I got um, almost perfect GPA and great GRE scores, and really thought that I was set. However, I didn't get into vet school the first time, and so that was a big setback for me emotionally. Um, but I think it's something that definitely made me the person that I am today. I wouldn't have met my husband or taken any of the career path that I had if I hadn't had that setback. And so that's something to keep in mind, that, just to persevere and be resilient. So I decided to use that gap time to get a master's of science in animal science. And that time was very helpful for me learning how to do research and to evaluate scientific literature. And it made me a much stronger scientist and a more mature individual to go to vet school. So I started vet school in 2007. And you see here, it's called the Ivory Tower because, the veterinary teaching hospital is where kind of everything happens perfectly, right? We always get a diagnosis and we have all the diagnostics we need, and we're able to pursue everything that we need to. And so I got to take care of lots of different species, even though I was pretty set on dogs and cats. You can see a collection of all kinds of other species that I got to treat. And it was a great 4 years. I think I really oftentimes think I wish I could go back to vet school. And a lot of people are like, it's so hard and it's like very stressful. But for me, it was just living the dream every day. So vet school is amazing. And then, as I mentioned, after my husband got moved to Kansas, I started as a small animal general practitioner in a practice in Manhattan, where I got to do so many different things. And that's what this slide is about, all the different things that a general practitioner gets to do. Because on any given day, you could be a surgeon, a radiologist, dermatologist, an endocrinologist. There's so many different facets to small animal general medicine that I love. And this picture I have on the right with Portia Puppy is one that I put because my husband jokes around just to get my goat. I think that I just go to work and pet cats and dogs all day. And so this is me petting a puppy. But besides just petting puppies, these are all things that I think I saw within my first couple weeks or months of work. The ones that are kind of look like little circles next to the ruler and the circle in the palm of my hand, those are bladder stones that I did surgery to remove from a dog. This fish hook was my first day of work, a dog that had swallowed this. The owner was trying to cast this fishing line and the dog just gobbled up the bait and the fish hook. And so we had to do surgery to remove the fish hook. The thing that looks like a gigantic worm is actually from a dog that had parvo, which is a really severe disease affecting the gastrointestinal tract in dogs. And this is actually a part of his intestines that sloughed out. So you can imagine how bad that dog must be feeling. But he lived, he did great. And then finally, the purple circle shows picture of an aspirate I did of a mass under a microscope because I really like clinical pathology. And so there's so many different skills that you get to use every day as a general practitioner. So as time moved on, I moved into a different position, and this one allowed me to curate some more of my interests. The picture down below with the three-legged cat, you can't really tell because I'm covering up one of his non-leg, but he has only 3 legs. And this picture is of us after we got our hospital AHA accredited, which kind of shows that we go the extra mile to make it very highly high technical standards and things like that. And I also curated a big interest in dentistry. And so this disgusting thing that looks like is attached to a Yorkie is like these calculus braces that are holding in this dog's teeth. And so at this position, I got to focus a lot more on my dentistry skills. And that's something that I take into this position I have currently with teaching dentistry to the students. And then the upper right corner is a gigantic pyometra, an infected uterus from a dog that had not been spayed and got infection. And so it can be life-threatening. So this was an emergency surgery that we did. And then, of course, this little eyeball sitting in a drawer of formalin where it doesn't belong because it was very damaged and had to be removed. And so I think that what I'm trying to explain in these slides is just like the breadth of experiences that a small animal practitioner can do in a day. Oh, I'm going to go back one slide. I'm going to lose my effects here. Let's see. So when I went to work at Kansas State, I hadn't had true emergency experience. And so I thought, is this for me? Am I going to be able to do this? I've seen these types of emergencies, right? Like this pyometra that I did, that surgery, but I haven't actually worked as an emergency vet. So I asked the people on the interview committee, I was like, well, will I be able to keep up? Like, is this going to be, too intense for me? And they're like, yeah, it'll just be like day practice, but at night. And so it was not day practice at night. This is obviously a lot more severe than what you've seen in the previous slides. It was just trauma all day long. Poor little dog with a prop toast eye because it got in a dog fight, and then another big dog, little dog, where this little dog got chomped in his sinuses, and this other dog who got the back of his leg shot off. And so a lot more fast paced. But for me at that point, I think I had stalled out a little bit on my development after being out for 5 years. I needed a new challenge. So this certainly presented that challenge. And so I got a lot of experience stabilizing critical cases and working with specialists at the Kansas State University Teaching Hospital. However, when this job opened, I was very, very grateful for the opportunity to follow my dream. And so currently I work at the University of Georgia Pet Health Center. And so, yeah, that was my career trajectory.
That was so cool. Thank you so much for sharing that. You really covered like how many different experiences that you've like done throughout your career, and it was super inspiring to hear. So thank
Good.
you. So next, I was wondering if you could share the most rewarding aspects of your career.
Sure. Um, I can kind of use the rest of my slides, I think, to talk about that. I think that some of the most rewarding aspects of my career have changed over time. And a lot of them are on this slide, though. So I kind of explain what a general practitioner does, and then I teach in the as a small animal general practitioner. Um, but something that I didn't really get to talk about in those pictures is the human animal bond, which is one of the certainly most rewarding experiences. This little patient in the middle with the white face is no longer with us, but his named Pee Wee. He was named Pee Wee. And his owner and I have formed such a bond because Pee Wee had so many medical ailments. And we really became like family to each other. We would jokingly say that Pee Wee was my godson. And you can see all the students have like crowded around and they love him. And the person holding him is one of our behavior techs. And so the most rewarding things about my job are getting to experience that human animal bond and to help people when they're in a tough spot. And whether that means, something I can fix or or just holding your hand for something I can't fix. Being there for the whole thing is really important to me. And then another really rewarding aspect for me is like seeing the light bulb go off for students. And so this is a photo on the right of one of my students learning how to do an ophthalmic exam. And so, there's a lot of things when I was struggling in vet school that I would pretend I had it because I was just trying to look good. And I didn't realize later, like, I really need to know how to do this stuff. And so being able to coach students and seeing when they're having a hard time and helping them come up with those ideas on their own is really rewarding for me. Um, Let me see. Oh, other things that have been really rewarding for me in this job in particular, above and beyond being a general practitioner, is that this job at University of Georgia has been very beneficial to helping me progress as an academician. So that includes being able to do outreach projects. So on the right, there's a picture um, from the Athens newspaper, the Athens Banner Herald, showing how we did some outreach visits where we went and provided veterinary care to homebound seniors. Additionally, I've had opportunities to publish and even travel the world. The picture on the left is me presenting at a conference in China about my research. And so being able to do those things to pursue my ABVP certification, which I achieved in 2011, 2021, 2011 anymore. 2021, are all things that have been extra special about working in academia. So yes, that's the answer to your second question.
Yes, thank you so much for sharing that as well. I think it's really incredible how much of an impact that you're able to make, not only on animals, but also like their owners and students as well in your case. And I think that's very like impressive.
Thank you.
So next, I was wondering if you could give me an idea about the key value sets, personal attributes, and soft skills that make veterinarians successful.
Sure. Um, I would say one that I had to learn early on, as I mentioned, was resilience. I think that, sometimes you're in a tough exam room, either, the client's not as motivated as you want them to be, or their patient has cancer and you can't fix it. Or or the owner's just grumpy because they, don't want to pay for some service that you really recommend. And then you have to turn around and go into the next room and be like, "Oh, I love your puppy." And even if you just euthanized a patient in the room next over and it was like the saddest day of your career. So I think that being resilient and being able to help, pay attention to your own mental health is really important in terms of being a successful veterinarian. I think some other things are being very self-directed. So you learn how to be a vet in 4 years in vet school, but you never stop learning. You can't learn all that in, just 4 years. And so students and faculty and adults and anyone that I see is still putting in the effort, being self-directed, being detail-oriented, um, in being curious and finding out the why and looking more directed into that themselves are very important characteristics. And then finally, I would say communication skills, because you can be the best doctor in the whole world, but if the person doesn't believe you or believe that you care, you won't be able to do any of it. So I would say those are my top attributes.
Yeah, that's very helpful. Those are really great points, and that's really great advice to take in. So, lastly, I was wondering, what do you think are some common mistakes that pre-vet or vet students make? And if there's like anything you wish that you knew before you went to vet school?
Yeah. I think that, again, like going back into not getting into vet school my first time, I just remember being so devastated. Like I thought the world was over. And even if I got in later, it just felt like such a defeat. Because I'm a perfectionist, I'm supposed to do things on this timeline. And I see that so much with the pre-vet students. We actually work a fair amount with the pre-vet students in the animal science program at UGA. And so I get to talk to them a lot. And that's always like, what if this doesn't happen on time? What if this doesn't happen on time? And so I would say one of my big keys of advice are like, there is no on time. Like it's on time for you. Like the trajectory that things take you is where you're supposed to be. That will help you become the strongest version of yourself. So not to get hung up with like rushing through any of these experiences. As I reflected back, that time in vet school was some of the most fun of my life. And, I think that, when we're always in a rush to get to the next thing, you miss out on a lot on the in between. Um, and then also another thing I would say that I would advise pre-vets, veterinarians, vet students, really anyone, is that you are going to make mistakes. You are a human being. It's impossible to be perfect. And so having compassion with yourself and seeing what you can learn from those scenarios instead of assuming that they'll never happen. I think when the students start making some mistakes, that's when they realize like this is actually really serious. I'm going to be a veterinarian. I'm going to be the final say on this. What if I make a mistake? And the short answer is you will. You just have to learn from them and make sure you don't ever make the same mistake twice. So
That's great advice. That you have a very like insightful and inspiring perspective, and I really admire that.
you.
This has been really helpful, and thank you so much for chatting with me today and sharing your perspectives and career journey. And I wish you continued success in your career.
Awesome. Thank you, Esha. So nice to talk to you today.